Welcome to This Week in Ophthalmology. This week we're covering 10 notable papers spanning advanced retinal imaging and therapeutics, diabetic retinopathy management and access disparities, and the systemic and demographic factors influencing ocular disease. Let's dive in. We begin with advanced imaging and therapeutics in retinal disease, when new biomarkers are helping us refine prognostic expectations and personalize treatment. In a systematic review, researchers evaluated the prognostic value of subretinal hyperreflective material, or SHRM, in patients with neovascular age-related macular degeneration undergoing antivascular endothelial growth factor therapy. Analyzing 33 studies, the authors found a consistent and significant association between the presence of this hyperreflective material and worse visual acuity over time. Specifically, greater thickness, wider dimensions, and the persistence of this material after anti-VEGF therapy were linked to poorer functional outcomes. Furthermore, 12 of these studies identified subretinal hyperreflective material as a strong predictor of subretinal fibrosis, with larger size and well-defined borders conferring the highest risk of fibrotic scarring. While its relationship with macular atrophy remains less clear, these findings suggest that tracking this specific optical coherence tomography biomarker can help clinicians identify high-risk eyes and potentially tailor treatment intervals. For patients who have coexisting geographic atrophy and neovascular macular degeneration, managing disease progression is particularly complex. A retrospective cohort study published in the journal Retina evaluated 31 patients with pre-existing neovascular age-related macular degeneration who had been on anti-VEGF therapy for at least a year and then received concurrent pegcetacoplan and anti-VEGF injections for an additional year. The study excluded patients with subfoveal geographic atrophy. Using spectral domain optical coherence tomography and fundus autofluorescence, the researchers found that the average growth rate of geographic atrophy decreased by 44% after starting pegcetacoplan. The square root transform lesion area grew by 0.39 mm in the year prior to pegcetacoplan initiation, compared to just 0.22 mm in the year following treatment. Crucially, visual acuity remained stable, and the concurrent therapy successfully managed geographic atrophy without destabilizing the pre-existing neovascular disease. Beyond macular degeneration, optical coherence tomography is also revealing novel microvascular signatures in diabetic eyes. Writing in the American Journal of Ophthalmology, investigators evaluated whether hyperreflective abnormal areas in the middle retinal layers, which they termed HAAs, could improve the detection of high-risk diabetic retinopathy in patients without center-involving macular edema. In an analysis of 275 eyes, these hyperreflective areas were manually quantified on on-face optical coherence tomography within a slab extending from the inner to outer plexiform layers. Incorporating these hyperreflective areas into a clinical model significantly improved the detection of referable diabetic retinopathy, raising the area under the receiver operating characteristic curve from 0.865 to 0.969. Every 0.1 percentage point increase in these hyperreflective areas was associated with more than triple the odds of having referable disease. While the association with vision-threatening diabetic retinopathy was directionally consistent, it did not significantly improve model performance beyond standard clinical factors. Nevertheless, these middle retinal layer changes represent a promising lesion-agnostic biomarker for identifying high-risk diabetic eyes during routine screenings. Our second theme addresses the clinical management of diabetic retinopathy and the geographic disparities that limit access to these essential therapies. In the British Journal of Ophthalmology, a randomized controlled trial compared microinvasive pars plana vitrectomy to standard pan-retinal photocoagulation for patients with severe non-proliferative diabetic retinopathy. The trial randomized 55 eyes to either standard 25-gauge vitrectomy or pan-retinal photocoagulation. At 12 months, none of the patients in the vitrectomy group had progressed to proliferative diabetic retinopathy, compared to roughly 7% in the photocoagulation group, a difference that did not reach statistical significance. However, the vitrectomy group demonstrated a significant advantage in preserving peripheral visual function. The mean loss in the total visual field point score was only 16.7 decibels in the vitrectomy group, compared to a substantial loss of 314 decibels in the photocoagulation group. These findings suggest that while both treatments are effective at preventing proliferative disease over 1 year, early vitrectomy may be a highly valuable alternative for patients who need to preserve their peripheral visual fields, such as active drivers. While clinical innovations continue to advance, a retrospective cohort study in the journal Ophthalmology highlights a major barrier to care, geographic disparity within the United States. Using the American Academy of Ophthalmology Intelligent Research Insight, or IRIS, registry, researchers analyzed over 11 million therapeutic and 35 million diagnostic procedures performed on more than 1.1 million patients with diabetic retinopathy. The analysis revealed a profound concentration of care, with urban practices performing 95 to 99% of all procedures. Even after adjusting for regional population differences in disease burden, urban practices still performed 65 to 90% of all services. Non-urban residents actually had a higher prevalence of proliferative diabetic retinopathy and higher overall rates of therapeutic procedures. Yet more than 93% of these rural patients had to travel to urban practices to receive their treatments. Furthermore, rural patients who traveled to urban clinics experienced a higher rate of care discontinuity, with nearly 48% experiencing a gap of over 1 year between optical coherence tomography scans. This discontinuity was disproportionately higher among older Black patients and those with lower household incomes, underscoring the critical need for targeted outreach and teleophthalmology programs to improve access to care in non-urban communities across the United States. Next, we turn to the anterior segment, focusing on risks stratification in angle closure, diagnostic challenges in corneal infections, and global standards for pediatric myopia. In JAMA Ophthalmology, a post-hoc analysis of the Singapore asymptomatic narrow angles laser iridotomy study identified baseline risk factors for progression from primary angle closure suspect to primary angle closure over 5 years. Among 161 participants who underwent baseline anterior segment optical coherence tomography and ultrasound biomicroscopy, 5% of eyes progressed. Multivariable analysis showed that a higher baseline intraocular pressure, which increased the risk by 60% per millimeter of mercury, and a higher number of plateau iris quadrants on ultrasound biomicroscopy, which more than quadrupled the risk per quadrant, were independently associated with progression. Additionally, a smaller trabecular iris space area, specifically TISA 750, tripled the hazard of progression. These findings suggest that clinicians should routinely utilize anterior segment imaging to evaluate narrow-angle patients, as identifying plateau iris configurations and narrow trabecular iris space areas can help identify those who require closer monitoring or early intervention. In corneal disease, acanthamoeba keratitis remains one of our most dangerous diagnostic and therapeutic challenges. A comprehensive review in Survey of Ophthalmology details how this sight-threatening infection frequently mimics other corneal infections, leading to delayed or incorrect diagnosis. While traditional culture and confocal microscopy remain standard, emerging deep learning image analysis of corneal photographs and anterior segment optical coherence tomography represents a promising future diagnostic avenue. The review highlights that early accurate diagnosis is the single most critical factor in achieving favorable visual outcomes, and clinicians must maintain a high index of suspicion in contact lens wearers with atypical treatment-resistant keratitis. In pediatric care, managing axial elongation is the primary objective of modern myopia control. To support this, a major pooled cohort study published in JAMA Ophthalmology analyzed individual participant data from the CREAM Kids Consortium, incorporating over 559,000 axial length measurements from more than 147,000 children across East Asia, Europe, and Australia. The researchers generated region and sex-specific axial length centile charts, revealing substantial geographic differences that widened with age and higher centiles. For instance, at age 18, the median axial length for girls was 23.31 mm in Europe and Australia, compared to 24.36 mm in East Asia. At the 97th centile, this regional difference grew to 1.27 mm. These modeled centile curves closely matched empirical data and provide a highly reliable clinical reference tool to help clinicians plot axial length to identify atypical growth and optimize myopia prevention and treatment strategies. Our final theme explores how systemic health and neurodevelopmental conditions intersect with ophthalmic disease. Writing in the American Journal of Ophthalmology, researchers conducted a retrospective cohort study using the TriNetX electronic health record network to evaluate whether chronic pain conditions are associated with an increased risk of dry eye disease. After propensity score matching over 538,000 patients with chronic pain to an equal number of controls, the investigators found that patients with chronic pain had a nearly 5-fold increased risk of developing dry eye disease. At 1 year, the incidence of dry eye was over 3% in the chronic pain group compared to less than 1% in controls, and by 3 years, the cumulative incidence rose to over 7% compared to 1.5%. Chronic pain patients were also more than twice as likely to require prescription therapies such as topical cyclosporine or Lifidgrasp. These findings suggest that dry eye disease in this cohort may be part of a broader systemic pain processing abnormality, indicating that a multidisciplinary approach may be necessary for effective management. In another study, researchers utilized the National Institutes of Health, All of Us research program, to compare the documented prevalence of common ocular conditions in adults with and without autism spectrum disorder. After matching over 5,000 participants, adults with autism spectrum disorder had roughly double the odds of having any documented ocular condition. Specifically, they had significantly higher odds of refractive error, cataracts, dry eye disease, glaucoma and strabismus, with the odds of glaucoma and strabismus being more than twice as high compared to controls. This elevated risk remained robust even after adjusting for socioeconomic factors like household income, education, and insurance status. These findings highlight the critical need for proactive, autism-informed adult eye care, including sensory and communication accommodations in the clinic, to ensure timely diagnosis and treatment. If you only have time for one paper this week, make it the development of the global axial length centile charts. This study provides pediatric ophthalmologists and optometrists with a standardized, region and sex-specific reference tool that is poised to transform how we monitor, risk stratify, and manage childhood myopia on a global scale. Here are the key takeaways from this week in ophthalmology. First, region and sex-specific axial length centile charts are now available to help clinicians identify atypical axial elongation and customize myopia management in children. Second, early microinvasive vitrectomy for severe non-proliferative diabetic retinopathy preserves significantly more peripheral visual field over 12 months, compared to pan-retinal photocoagulation, with similar rates of progression to proliferative disease. Third, narrow-angle patients with higher baseline intraocular pressure, plateau iris configuration, or a smaller trabecular iris space area face a significantly higher risk of progressing to primary angle closure. Fourth, patients with chronic pain conditions have a nearly 5-fold higher risk of developing dry eye disease, suggesting a shared systemic pain processing pathophysiology. And finally, adults with autism spectrum disorder face more than double the odds of having treatable ocular conditions, highlighting the critical need for proactive, autism-informed screening and clinical accommodations. That's your roundup for this week in ophthalmology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.